Medicare supplement plans, or Medigap, what are they? How do they work? Great question. I'm going to go through all that right now. I'm going to show you exactly what a Medicare supplement plan is, who would want one, why you would want one, when you would want one, and where to get one, and how to figure out exactly everything that you need to know about a Medicare supplement or Medigap plan. So stay tuned. All right, so we're going to talk about Medicare supplement plans. It's also called Medigap. It's exactly the same thing. First thing that throws people off is the difference of Medigap or Medicare supplement. It's exactly the same thing. So it's just two different names, but how they actually function. So what a Medicare supplement plan is, and in the name Medigap, supplement or gap, it fills in the gaps in original Medicare, Part A and Part B. It supplements that coverage. So that's exactly what they are. They're designed really to limit your out-of-pocket expense when you utilize your health insurance down the road. I just wanted to jump in for a quick second and invite you to join my private Facebook group, Talking Medicare, where you can get answers to just about any questions on Medicare and interactions with others that are also in Medicare. There are no agents, no sales whatsoever. It's absolutely free. Just visit talkingmedicaregroup.com. It'll take you right there. You can sign up for free. Easy to do. Enjoy the video. So that is what a Medicare supplement plan is. Now, there are nuances to them. There's differences. There's different choices. You have to make some decisions. So we're going to go through that right now. So when you would want a Medicare supplement plan is if you're going to stay with original Medicare. And that's something that I always recommend, is do whatever you can to stay with original Medicare, Part A and Part B, because it is fantastic coverage. Your life will be much simpler down the road when you know exactly how your health care is going to function. It's completely different than choosing Medicare Advantage. So those are your two main choices, staying with original Medicare or going to a Medicare Advantage plan. So if you stay with original Medicare A and B, there are some big out-of-pocket expenses that you would not want to be responsible for, which is why you get a Medigap plan or a Medicare supplement plan to really cover those out-of-pocket expenses and make the cost very manageable as you use it. So that's who would want a Medicare supplement plan. Somebody that's staying with original Medicare, it's almost a given you're going to get a Medicare supplement plan. Now, when can you get a Medicare supplement plan? And really, you could get one at any time, but there's some things to understand on qualifying for Medicare supplement and how it actually works. So when you first come into Medicare, whether you're turning age 65 or whether you're retiring, you're already past age 65, when you start your Part B coverage, that is when your window opens to really get whatever you want without any medical questions. So you have a 6-month window from when that Part B starts. So if you start your Part B on January 1st, you're going to have 6 months without any medical questions to get a Medicare supplement plan. Now, most of the time, it really doesn't pay to wait to get it because you may need it before you're able to get it. So you want to generally start your Medicare supplement coverage the same time that your Medicare Part B starts. In other words, when you're starting Medicare is when you want it to all connect together. So that way that things get covered the way they're supposed to get covered and you don't have any surprises or big out-of-pocket expenses. Now, you can get a Medicare supplement later. There's no penalties if you wait or if you do something else and then you want a Medicare supplement later, or if you want to change Medicare supplement plans down the road. There's simply a month-to-month plan where once you have one, it's guaranteed that you can keep it, but it still runs month to month. So as long as you pay the premium, you can keep it. But if you want to change it, or if you want to get out of a Medicare Advantage plan and get a Medicare supplement plan, you can do that as well. Now, there are caveats after that 6-month window. In most states, you do need to go through medical underwriting and be approved to get a Medicare supplement plan after you've gone past your open enrollment period. Now, it's not complicated. There aren't any physicals. There aren't any blood tests. There's nothing, no doctor visits required. You simply answer a list of questions, and I can put the list of questions in the description below the video. I'll give you a sample of questions. pretty much big stuff, cancer, COPD, Parkinson's, blood disease, things like that, stuff that would generally prevent you from getting life insurance. But if you can answer no to all the questions, then you have a pretty good chance of being able to qualify after your open enrollment period for a Medicare supplement plan. If you answer yes to any of the questions, then it's pretty much an automatic decline. So it's pretty easy to understand it, pretty easy to know where you stand. And again, take a look at the questions if you're wondering on whether you can qualify. A lot of people think they don't, and a lot of times they do. So we get people approved all the time, every day, just about, for a Medicare supplement plan, either changing from one to another to lower the price, or coming off a Medicare Advantage plan and coming back to original Medicare with a Medicare supplement plan. So certainly worthwhile in checking it out. And all they can do is say no. So it doesn't make any sense to not try if you think, even if you're borderline on what you think you may qualify for. Now, there are also a handful of states that have certain regulations and protections where they have things like a birthday rule, or some states have no underwriting whatsoever. So we can walk through that with you as well. Birthday rule means if you already have a Medicare supplement plan and around the time of your birthday, you can change without medical underwriting. So it's important to make sure that we work as best we can within the parameters they give us. So we want to play the game as best we can play it. But there are more and more states coming along now with Medicare birthday rules, which gives you the ability to change a plan if your rate has gone up, to be able to get a lower rate for the exact same plan that you have for your Medicare supplement coverage. So give us a call or fill out the form on my website and we'll walk through that with you, and we'll just make sure we get put in the best position that we can going forward down the road. So where do these Medicare supplement plans come from? They come from private insurance companies, pretty much the same insurance companies that offer Medicare Advantage plans, but it is a completely separate vehicle and has nothing to do with Medicare Advantage. A lot of times I talk to people on Medicare Advantage and they think they have a Medicare supplement, and it's just not the same. With a Medicare supplement plan, you don't have any restrictions, meaning you don't have any networks of doctors and hospitals. You can literally go to any doctor, any hospital, anywhere in the country without asking permission. And that's just a main reason why I would want to stay with original Medicare, because I want to control my health care. When I need it, I want to be able to go to who I need to go to without having to ask an insurance carrier for permission. With a Medicare supplement plan, you also have no pre-authorizations, where under a Medicare Advantage plan, just about anything you do outside of routine care, the doctor has to ask the insurance company if it's okay and will they pay for it. With a Medicare supplement plan, just not the case. If your doctor says you need it and you agree and it's medically necessary, then it's approved. Medicare does not get in the way of what your doctor recommends or creates your treatment plan around. So it certainly gives you the freedom and the flexibility. And again, if something serious comes along, it's exactly what you're going to want when it's time to get everything put together. So very important to understand the differences between the original Medicare with a supplement and the Medicare Advantage plan. So how does a Medicare supplement plan work? And it's also pretty simple. There's actually 11, I think 12 choices of different Medicare supplement plans, which just doesn't make any sense. There's really only 3 main options right now. And the reason it boils down to 3 is value. So these are plans that are priced correctly. There are others available, but they just aren't priced the way they should be. So it doesn't even make sense to compare them. But we have Plan G, Plan N, and Plan GHD. And those are really the 3 main options. And we need to find the value within those 3. What makes the most sense pretty much in your zip code and in your situation. And they really run kind of like they should. Plan G, I would almost call it too good. It's a very, very good plan with limited out-of-pocket expenses. You're only out of pocket for the year is the Medicare Part B deductible once a year. And right now, that's $240. So your maximum out of pocket, if you have original Medicare and a Plan G for the year, is $240. Then the plan pays 100% after that. I guarantee you, coming into Medicare, you don't have anywhere near as good a coverage as original Medicare with a Plan G. So Plan G, in my book, is great, but it's almost too good. Then we have Plan N, which is very similar to Plan G. There's not a whole lot more out-of-pocket expense, but there is some. So it has that same Part B deductible, which is $240 right now. And then also, when you go to the doctor's office, there's a $20 copay, no big deal. If you go to the emergency room, it's a $50 copay, also no big deal. And then Plan N also has something called excess charges. I have a video that goes through very specifically the differences between Plan G and Plan N. Make sure you take a look at that. I'll put the link below in the description of this video as well, but it gives you a real clear idea the difference there. So Plan N, to me, is great, and it's kind of in the middle. It would likely be Goldilocks' choice. It's just right in most cases. Now, it really depends on the premium. In some places, Plan G premium is very competitive, and if it's very competitive, I'm likely going to choose Plan G because it's great. It's too good, but if it's priced right, then it's exactly what we're going to want. But if it's high on price and Plan N fits better, again, not a whole lot of difference in out-of-pocket expense, then Plan N is going to be just right in the middle. And then we have some states that have additional regulations that make it easier for you to go back and forth from a Medicare supplement to another Medicare supplement, and limits medical questions and things like that, which is great. But what it does, it also drives the premium up because they can't cherry pick the ones that they want. They have to pretty much take everybody. So if that's the case, where premiums for N and G are significantly higher than they are in a lot of other parts of the country, then we're going to look at GHD. And GHD is not a bad choice. I would classify it as not bad. And it's actually pretty good, probably very similar to what you might have right now. GHD is basically Plan G with HD on it, which is high deductible. So it takes that little deductible and it makes it bigger. But it also takes that big premium and makes it smaller. So it depends on the differential in premium to whether it's going to make sense. Plan GHD right now has a deductible of $2,800. That's a big deductible. You wouldn't want to face that deductible if you don't have to. But if the premium is $1,300, $1,400, sometimes even $1,600, $1,700 a year less than Plan G, then it's making sense to look at that deductible because we're going to save a tremendous amount on the premium side. And the way Plan GHD works is Medicare, for most everything, is going to pay 80-20. So Medicare is going to pay 80%. You're only responsible for 20%. And then if your 20% reaches that $2,800, then it turns into 100% coverage. So your maximum exposure under Plan GHD for the year is $2,800. Again, probably better than what you've had at work for the last 20 years. So it's really not, it's not as great as G, it's not as great as N, but if the premium makes sense, then it absolutely can be great as well. We'll save money on the front end, spend a little more money on the back end. It's fantastic if you're in great health, you've always been in great health, then why not take a lower premium? And again, it depends on the differential in premium to whether or not it makes sense to go with that deductible. Something else to understand about Medicare supplement plans and the difference between that and Medicare Advantage. Medicare supplement plans, even though they're offered by a private insurance carrier, that insurance carrier plays no part in any decision of what's covered. It really is fantastic. I don't know why Medicare didn't set it up the same way with Medicare Advantage, but they set up original Medicare with a Medicare supplement really in a really good way that benefits you. And the way it works is when you go to your doctor, you give them your Medicare card and your supplement card, and if they take original Medicare, they have to take your supplement. They don't have any choice. They can't say, well, we don't take this company or that company. There's no decision on their part on what they accept. And then when the doctor bills, they send a bill to Medicare. Medicare then coordinates it with the supplement company and collects payment altogether. So the doctor's office has no direct contact with the insurance company. the insurance company has no decision on what's covered or what's not covered, or if something is authorized or not authorized. It really just works like clockwork, and it's absolutely the way healthcare should work, but in most cases it doesn't. But under original Medicare with a supplement, it does, and hopefully someday we can get to where they bring Medicare along to everybody with a supplement type coverage where, again, if your doctor says you need it and you agree, it's covered. It's medically necessary. It takes away all the games that they have to play. With a Medicare Advantage plan, doctors really have to jump through hoops and do all sorts of extra paperwork, and I guarantee you they pull their hair out every night trying to get paid, trying to get things approved, and it's just not what should be happening in the doctor's office. We want us to be happy. We want our doctor to be happy. So we just want things to go the way they're supposed to go. If we have an issue, Medicare covers it, supplement covers it, it's done. There's really nothing to it. I've been doing this a very long time. I have thousands of clients. They're all on Medicare supplements. I don't have anybody that's on a Medicare Advantage plan, but I get zero customer service phone calls. Literally, I don't get any complaints. There's no problems. There's none of this didn't get covered, or my doctor's not in the network, or the hospital won't accept it. There's none of that. It goes exactly the way it's supposed to go, which is why I will hopefully always only recommend original Medicare with a Medicare supplement. It's just fantastic coverage. It's what I would want any of my family to have, and hopefully it's something that you would see that way as well. And again, there's a premium to a supplement plan, but we try to keep it as low as we possibly can just to make it affordable as we go down the road. So that gives you a pretty good overview of Medigap, Medicare supplement. That's what we do. We help with that. So if you are going to stay with original Medicare, I certainly would appreciate it if you allow us to help you. There's no cost to you, but that's how I make my living. Whatever insurance carrier that we choose, they pay me a little to be your service agent. So I will be your service agent now and in the future for anything that arises, or if we do need to do comparisons in the future, then we just keep it all together the way that it's supposed to go. So I hope you found this helpful, and also make sure to take a look at this video, because this will also help you as you go along with things you're going to need to know. And there are other costs that are involved in the Medicare. So hope you find it all helpful. Have a fantastic day.